Hey, respiratory instructors out there, Dennis Stanley with Lindsey Jones. I just wanted to share with you a few things we've learned about the 2027. You know, we're always going to keep you updated on the 2027 NBRC exam changes. Right now, you'll have to excuse me, I'm traveling. Just went to New Jersey and taught a 3-day seminar in New Jersey at Union County College. And now I'm in Los Angeles getting ready to teach at Santa Monica College for 3 days. But we're always preparing for the NBRC 2027 examination. A couple things that you might know already is that what we know is that that's going to be 180 questions, but 160 of those are going to count. So it's 160 scored questions. That's 20 more than what we have right now with the TMC exam. You also might know that it's going to be a 4-hour exam. It's going to be split into 2 sessions. The first session is going to be basically their breadth of knowledge, and this is the kind of area that we think are going to duplicate what's called the recall and the application portion of the examination. And then there's going to be another 2-hour section called the depth of clinical judgment. By the way, there could be a break in between those 2 sessions. They're calling it an optional break. So if a student wants to, they can do it for 2 hours, take a break. I don't know how long for, we'll have to find out. And then they can go back and do the other session for that. Now, one thing that we know is that the depth of clinical judgment really is going to replace what is now the clinical simulations. And word on the street is that they're going to ask in a very similar style. So far they're denying, and I always ask this, we'll totally keep up with this, that they're going to have a scenario and then have multiple questions. But at the very least, they're going to have deeper analytical questions that you're going to have to analyze, that are going to be kind of like a clinical simulation scene, and maybe with some data, and then you're going to have to make a good judgment on what the answer is there. And so that's going to be very interesting. I want to dispel something interesting, another interesting fact right now, or a thought, and that is that we think that the clinical simulations are going to end in 2027, and that's not exactly true. This is very interesting. What we find out is that if a candidate has taken the TMC portion and passed at the higher cut score before January of 2027, in other words, they have to do it by December 31st of 2026, then come the new year, they actually have an option. So for 1 solid year, they will have the option to take the 2027 clinical simulations. Not really the 27 clinical simulations, but they can take the clinical simulation exam. So the ClinSim exam is actually going to be offered in 2027, but only to those who have passed at the higher cut score by December 31st, 2026. What I find most interesting is that they're going to have an option. So they can either take the ClinSims or they can take the brand new exam, which is going to be the respiratory therapy or the RT examination, the RTE. And that's going to be the new test. What your students will choose, I don't know. But let me remind you that we're sensitive of that time. We recognize that people are going to be on the cusp one way or the other, whether they're using our home study or you're using us in school. We're going to give, in about mid-2026, the ability for a candidate or a school to choose to study or to move over to the 2027 material anytime they want to for their group. And you would do that because your group is probably going to pass the course in 2027, so you know they're going to take it, but right now it's 2026. Well, not now, but at that point it'll be 2026, and you'll wonder, how do I do that? Anyway, I just want to give you that kind of brief update of where we are with the 2027 NBRC exam preparation. Also, if you need to know a little bit more about Lindsey Jones, if you're not using us, feel free to call us. We can give you a tour. Laura in the office can even set you up with a free account so you can check it out, pretend like you're a student, see what they experience. You can also see some very nifty tools that are used for instructors to see what they can do in their own program to increase their pass rates of the examination. And it has to do with the fact that the Lindsey Jones has more data than any other entity. So check it out. We'll see you around.